How long does it take to see results? That's question number 7. Now, of course, results will vary from patient to patient and from case to case. So I can give you generalizations that I've seen in my office for the last 24 years, okay? And results really comes to two, maybe three main categories. One is pain, okay? Relief of pain, the main thing that brings people to our office. 2 is functional improvement, and 3 is then the structural changes that we see on x-rays, okay, and posture, okay? So typically in the first 12 weeks, I see people's pain improvement reduce anywhere from 50 to 80%. So a 50 to 80% reduction of pain in the first 12 weeks. Of course, there's those people that have more pain improvement, as an outlier, and then there's those more people that have less of pain improvement, depending on the case, okay? That's kind of the average, and that's pretty realistic when it comes to chiropractic care in general. One of the things that kind of is interesting that I find is that we get patients that have come to us after other forms of treatment have failed them. They've tried physio, they've tried traditional chiropractic care only, they've tried exercises, medications, injections, you name it. And the only thing they didn't try was corrective chiropractic care. So they've been suffering with these symptoms for many years, right? And then we start to introduce our program that includes corrective chiropractic care and chiropractic biophysics, and then they begin to see these results in the first 12 weeks, okay? 50 to 80% reduction of pain. Again, that's a generalization that I've seen across the board. It may not be applicable to you specifically if you were to come into my office, but that's what I've seen. So in many cases, the one thing that was the difference that patients got in our office or an office like ours that does corrective chiropractic care and CBP stands for chiropractic biophysics, that they didn't get in another office or another place is the corrective care component, okay? And then the other part is functional improvement. So as pain reduces, right, then people's function improves. Walking, standing, bending, lifting, sitting at the desk or in the car, right? Sleeping, going to the gym, handling your kids, doing house chores, right? Recreation, going for a walk. All these things are important daily activities of daily living and functional changes that we've seen. And we score these things with questionnaires that we give our patients at the beginning, and at every re-exam, their pain scores decrease and improve, and their health status scores increase and improve. So we can monitor this along the way. So it's pretty cool. Then the third thing is structural changes, okay? Now the structural changes, when it comes to posture, we take before and after pictures on our posture screen app, and I do see at least 80-90% of our patients see some form of postural improvement, right? But then it comes to spinal changes, okay, that we see on x-rays. And that realistically is the hardest thing to change, okay? Many people come in with chronic spinal conditions and misalignments that have been with them for 10, 20, 30, 40 years, as evidenced by the amount of arthritis degeneration on their spine. So it's unrealistic to expect that to improve and change dramatically in a matter of weeks or even months. So sometimes people may need 1 course of care, sometimes they need 2 courses of care or 3 courses of care, and it's been shown by many case studies, in CBP and also corrective chiropractic care. So if we get people out of pain, 80% reduction of pain, they're improving their function and quality of life, and even if this just stayed the same, that's still a great result, okay? But 20, 30, 40% of the people will see some structural changes even in the first 12 weeks, okay? So that's kind of a guideline, okay? And if someone can actually use more corrective care after the first 12 weeks, then we apply more corrective techniques if they're willing to do that.